Hello, everybody. My name is Dr. Zha. I am a physician at CBHA. I'm also the clinical lead liaison of the CBHA COVID-19 task force.
Hello, I'm Dr. Jude Alsarraj. I'm a clinical team member here at CBHA, and I'm working with Dr. Zha on the COVID-19 task force here at CBHA.
This morning, we have a quick update for you. Hopefully, we can answer some questions you might have at this stage of the disease spread in the nation. But first of all, we want to emphasize the importance of social distancing, which means that we need to be 2 meters away from each other or 6 feet apart. And I'm going to show you how far that is. So about here. Okay. So Dr. Jude, I have a question about the definition of pandemic. On March 11th, the World Health Organization announced that COVID-19 is now a pandemic. Can you explain, as a scientist, what that means?
So pandemic is really the worldwide spread of a disease to different countries, to all countries. So basically this virus really does not have boundaries, does not have any discrimination, and we just have to be careful. Everybody can get infected, everybody can get sick with it everywhere on the globe. And so that actually leads to my other question is close contact. So we hear close contact. So what is really close contact? Can we get sick just by passing by somebody who's sick, or how does that? How is that defined?
You're not likely to contract the virus by passing by somebody who's sick. The definition of close contact is twofold. Number one, if you are not practicing social distancing, if you are 2 meters, within 2 meters or 6 feet within somebody who might have it, and also at the same time having prolonged contact, which means that if you're in the same household, if you're visiting them, or if you are taking care of them as a healthcare provider, then you are likely exposed. Or you can get in touch with somebody who actually has COVID-19 and be in touch with their secretions, such as when they cough on you directly. So my third question for you is that we hear the word incubation period of a virus. What does that mean, and how long is the incubation period of COVID-19?
So incubation period is really the time between exposure to the virus and the time somebody can get sick and the symptoms start to appear. For COVID-19, the incubation period can be anywhere between 2 to 14 days. The median incubation period is 5 days, but really any time between 2 to 14 days can be actually an incubation period, and you can start to see symptoms on that.
So Dr. Jude, what if I get sick with COVID-19, or I'm exposed to somebody who might be sick, or if my physician tells me to quarantine or isolate? What does that mean?
So quarantine is really the separation and restriction of the movement of healthy people who may have been exposed to the virus to see if they're really going to become ill. So people may have been exposed, they don't know that they're exposed, they have not shown any symptoms. So it will help stop the spread of a disease if we do that quarantine. And really quarantine and self-isolation are a little bit different. So for the quarantine, it's usually healthy people who have not been sick yet. They're not sick and they're waiting to see if they're gonna get sick. So this is quarantine. Isolation is different. It's people who are already sick and they try to isolate themselves from their family members, from other people, because they are really they're a danger for us, because they can really get us infected and get us sick.
Mm-hmm. So I do want to emphasize that if you are told to self-isolate or quarantine, you have to follow rules and guidelines by your provider, as well as the local health department and the CDC. I want to talk a little bit about how to properly self-quarantine and isolate.
And just how to get ready for that. You know, we tell that patients quarantine or isolate. We don't really know what that means. So
Yes.
if you can explain a little bit about what we need to do, what we do not need to do, that would be great.
Okay, so during the duration of isolation, you do need to be relatively isolated inside of your house also. I recommend that everybody right now to pick out a room in their household, ideally with a bathroom, to be separated for only that purpose in case somebody needs to be isolated or quarantined. This room hopefully has enough supplies in it so that you can comfortably live in there for 14 days. When you're isolated at home, I recommend that you have no visitors. If you you must practice social distancing at home as well. If you do get into contact with people, you need to practice that 2 meters away. So don't go outside if you can help it. If you do have to go to the doctors or go to some essential visitations, I recommend that you wear a mask. since you're being quarantined and isolated. When you do have to sneeze or cough, please sneeze and cough with your mouth covered. If you can't, sneeze into a tissue and then discard it in a trash can. After you sneeze or cough, you must wash your hands with soap and water for at least 20 seconds. Ideally, you want to be washing your hands frequently anyway at home. Please don't share any utensils or anything really that can get your secretion on it at home with other household members. Ideally, you want to isolate your linen as well. You don't want to share any bed sheets or anything that you can put your hands on as well. So there are surface areas that are considered high touch, such as table, utensils, bathroom counters, and such. These need to be frequently disinfected with a household cleanser.
Maybe doorknobs as well.
Doorknob as well.
Computers,
Mm-hmm.
remote controls. I think
Yes.
these are things that we use all the time that
Definitely.
needs to be disinfected.
When you are in self-isolation or quarantine, I want you to watch out for symptoms. If you do develop symptoms such as cough, fever, shortness of breath, first thing you do, you want to call your local provider. You want to report your symptoms, and you want to make sure that you follow directions. Do not just rush to the ER or the clinic as soon as you have symptoms. We want to know about it, but we also want to keep the rest of the community safe. So in terms of housemaid, if you do have somebody who is isolated at home, the rest of the housemates can actually go out and do things such as grocery shopping, even going to work, so long as you practice that social distancing at home and you practice those guidelines that we just talked about in terms of disinfecting and covering your mouth. So if you are a housemaid and you do have to get in contact with a person who's in isolation or a quarantine who is actually symptomatic, you need to be wearing a mask. If you do have to handle their bodily fluids, such as oral secretion or stool or anything like that, I want you to be wearing gloves as well. And if you get in touch with sick patients at home, those masks and gloves need to be thrown away. They cannot be reused.
So, Dr. Zha, can you tell us a little bit about the CDC recommendations for disinfection?
Okay, that's a good question. So first of all, hand washing is still the most important methods that we have for distancing, disinfection. This is because we cannot always control what we get in touch with in the environment, but we can always control what our hands bring to our face and our mouth. Okay, so I want to emphasize that if the surface that you are about to disinfect is actually dirty with visible dirt and other substance, I want you to use a detergent or soap and water to clean the area first before you go ahead with disinfection. So for disinfection, anything like diluted bleach, household bleach solutions, or alcohol solutions with a 70% or higher alcohol content, as well as any common household disinfectants can be effective. I want you to follow the manufacturer's guideline and instruction at the back in terms of disinfecting. Make sure that your solution or your disinfectant is not expired. So when you are dealing with laundry, especially if you have a person at your household who is on isolation or quarantine, I want you to make sure that you don't shake the dirty laundry, because that aerosolizes or make it possible for the virus to go into the air. So dirty laundry that has been in contact with patients or people who are on isolation or quarantine can actually be washed together with the rest of the household laundry. You also want to make sure that you're actually disinfecting the cart that you put the laundry in after doing each laundry as well. This also seems like a good place to emphasize that we need to be conscious about going out and buying things in a panic. We recommend that you do not do that. You need to be leaving enough things in the grocery store for your neighbors as well. And if they don't have enough things in their household, they cannot protect you from getting infected. So please don't panic shop everything and cleaning out the grocery stores. So Dr. Jude, I hear people talk about reinfection. If somebody catches COVID-19 and they recover from it, can they catch the disease again, or do they have immunity against the disease?
So from China's experience and a report that they published, that reinfection may happen. However, a recent animal study has showed that really reinfection does not happen. So we're hoping this is the case, and more research has to be done to be able to answer this question.
And from my understanding, in that study where it shows reinfection can happen, the reinfection rate is very low,
Right.
0.2%. Is that right?
Exactly, and it could be just like an error, and it's either an accurate test, maybe it did not show the actual result, and it could be that patients were said that they were recovered too soon, so they were not really recovered, they were still sick, but they were announced recovered too early.
Okay.
So that does not mean that they got reinfected, it could be just kind of an error. So let's move on to the next question. So if this is a virus, why cannot we use antivirals? Like, we do that for influenza, for example, when we get infected. Or if we get sick, what medications can providers do here and give here for patients that come to CBHA who are infected with coronavirus?
That's a good question. So the medication we use to treat even influenza does not actually kill the virus. It is supporting people's symptoms. Unfortunately, currently there is no such treatment or any cure for COVID-19. What we do in medicine is called supportive measures, which means that we do support patients however they need to facilitate that recover on their own, relying on their own immune system. That might mean that we give them oxygen when they need to, we treat their cough if the cough becomes too miserable, or give them medication to control that fever and pain. At this point, I really do want to emphasize that over 80% of people who have contracted the disease in China have made a full recovery. This means that it is very possible and doable for you to recover at home. When you do get sick or feel like you might be sick with COVID-19, please don't just rush to the ER or the clinic. Call your provider team, ask them what to do. Very possibly, we can treat you without seeing you. We can make sure that you are safe at home, and you can make sure that the community is also safe around you. So my next question for you is, now that we are going to answer a lot of questions for children and we have to speak to our children about what's going on, since you are a parent, can you tell us a little bit about how to talk to kids about these things?
Yeah, so answer their questions, give them the permission to ask you, and have an opinion in that. Let them know that not everybody who coughs next to you has the coronavirus. So this is also important. We don't want to discriminate or anything. Just make sure that you emphasize hand washing for 20 seconds. I mean, hand washing can be boring if you're doing it for 20 seconds. So you can sing songs with them, ABC song, happy birthday song. Actually, a lot of kids' songs are 20 seconds long, if not a little bit longer. And also practice with them coughing and sneezing into the elbow, or better with a tissue, but make sure that after they cough or sneeze in the tissue, to put in the trash can and go back to the bathroom and wash for that 20 seconds. So this is really important. The other thing that, don't panic too much in front of them, because really kids pick up on adults' anxiety. So just make sure that you are calm when you talk to them about that. And also let them know that isolation is not really timeout. So you're not putting them in timeout. There's just this very special time that we have to be away from friends, away from family, just for now, and hopefully things, will get better. And also have them decide what they want to eat, for example, or what food you want to have at the house. Talk to them, say, let's say we're going to be at home for 2 weeks, we can't get any food. What do you like to eat? Is there anything specific that you want me to buy so you can have it, if we can't leave the house? But again, I want to emphasize on Dr. Zha's point that don't panic and go buy the whole grocery store, but at least, have enough that will help you for, the amount of time that you have to be home. Now, the other thing that I think we have to talk about is talk to them about isolation and quarantine, because if for any reason one of the family members had to be quarantined or isolated, they need to understand why we're doing this. And if it happens, we have to stay in a separate room, and just, let them know that this may happen. Hopefully it will not, but just have them, ask the questions, answer their questions, and talk to them basically about it. Don't watch too much news next to them. That's what they're saying. Kids, hear the news and they get really scared of that. So try to avoid a lot of news in the house, but that's the best we can do for now. And so is there anything else that you want to add, Dr. Zha, about basically the coronavirus, or anything before we end today's video?
Yes, I would like to emphasize to the community that CBHA is committed to protecting you as well as the rest of the community. We can help you and protect you just as effectively on the phone as when you come in person. So if you do have questions or concerns, we encourage you to call us first. Thank you.
Great. So thank you very much, everybody, for listening to us today. And we're going to end today's video, and we'll see you again soon. Thank you.